So can you tell us how Societi came about?
My family experienced Kawasaki disease just over 8 years ago now, and I decided at the time I was going to find out everything I could, and I came across very quickly lots and lots of websites, but lots of information that invariably was either out of date or I couldn't necessarily trust as a parent. But I persevered, and I've read a huge amount of research papers and academic papers on Kawasaki disease. And a couple of years ago, just over 2 years ago, I read a paper which really was the beginning of Societi, in as much as that it identified some ongoing lifetime risks for children who'd had Kawasaki disease. And I expected when the paper was published there would be some order of outcry and certainly an action plan in terms of what happens next and what needs to be done. Because one of the things the research paper said was there are these lifetime risks, but we can't really quantify them and more research is needed. And I saw no action arising from that and was really determined at that point, having monitored everything that had come out since we'd been affected by Kawasaki disease. There'd been no change in the UK, there'd been no increase in awareness, been no step change in terms of clinical care and long-term management for children. And so I decided, with no background in health, I'm not a clinician, I'm a parent, but with a background working in government organisations, background in bringing together partnerships and developing policy, that I could apply those skills to the problem of Kawasaki disease with a view to bringing a voice to Kawasaki disease in the UK.
What are the key main goals for Societi?
Societi has 4 main aims, and I didn't just sit down and think about these myself. I talked to a whole bunch of people and got in contact with the main clinicians, the leading clinicians in the UK, and asked them what needed to be the priorities for an organisation that was working to create change around Kawasaki disease. And we have 4 main aims. Our number 1 aim is to raise awareness, because what's really clear, and was our experience too, lots of families are coming up against Kawasaki disease, but many doctors don't know it. And when we had our diagnosis, it was the first time I'd heard of Kawasaki disease. So raising awareness across the clinical community, but also across the general public, is of huge importance to us. It's a very significant focus for our work. A second aim is to improve the amount of UK-based research that happens, because a lot of the research that takes place globally, whilst it's very valuable and answers lots of questions, it doesn't necessarily apply automatically to a UK population and a UK audience. So I felt it was really important that we had a UK evidence base that would encourage UK clinicians to act and to understand Kawasaki disease and how it affects our population. The third aim is around clinical supervision and improving that, because it's very apparent talking to people that there's a bit of a postcode lottery, depending on where you are, depending on whether your paediatric cardiologist or your paediatrician knows Kawasaki disease and understands the lifetime risks, especially if your child has had cardiac involvement. The amount of supervision that you get going forward after the initial acute episode varies wildly. So I was really keen that as Society we bring to bear a bit of a focus on what that clinical supervision should be, and to make that consistent so that every child and every family gets the support that they properly should have following an acute diagnosis of Kawasaki disease. And the last aim that we have, and it's by no means least, is working in partnership and working to support the parent support group. Kawasaki support group were an invaluable resource for me as a mum experiencing what I call the flat spin of a Kawasaki disease diagnosis, which is it's very difficult to be to have that imposed on your family, for that to happen to you, and for people to to be talking to doctors who maybe have very limited experience of it. There's a real need to be able to talk to other people who've been through that experience as a family. So the support group, who are very much a co-producer of Society and our close partners in all we do, supporting the support group and allowing them to achieve their objectives is very much an aim of Society.
What are some of the current statistics of the treatment time for Kawasaki disease, and how does Society hope to improve that?
There was a BPSU study done running up to 2015, and that identified a couple of really important things: the increasing incidence, so increasingly common Kawasaki disease, but it also identified a link between early treatment times and better outcomes and later treatment times and poorer outcomes. Now, those things aren't completely binary, they're not mutually exclusive. You could have a late treatment and a good outcome, and you could have an early treatment and for whatever reason have a poorer outcome. And we know that and stats vary globally, but about 4% of cases children appear to be particularly predisposed to having heart damage, whatever the interventions are. So it doesn't necessarily follow that there's a panacea of, get the treatment early and you've no lifetime effects. Unfortunately, we don't have the ability to be able to do that at the moment. But what that study shows, as well as increasing incidence, is the real need to raise awareness so that we get early recognition, early diagnosis, early treatment, so that fewer children, to the extent that that's possible, fewer children have the lifetime challenges of Kawasaki disease that far too many children, way too many children today have. And some of that, not all of that, but some of that is because of low awareness and late diagnosis and late treatment.
How does Society Foundation hope to improve the long-term care and treatment given to Kawasaki disease patients?
I think in terms of long-term care and changing that, one of the material things that we can do is change perceptions around Kawasaki disease, because for too long there has been too many myths and too many misunderstandings about what the disease is. It's had labels of being rare. We know it is increasingly common. There's been a 4-fold increase in hospital admissions in the last 9 years. And with about 20,000 people in the UK who've been affected by Kawasaki disease that we know have had a diagnosis, notwithstanding those who haven't been diagnosed or have been misdiagnosed, by any estimation, Kawasaki disease is increasingly common. So with that growing population of children, young people affected by Kawasaki disease, there's a growing number, and our poor outcomes, because we perform amongst the poorest globally in terms of heart damage and coronary artery aneurysms in children affected by Kawasaki disease. But we've got a growing population of children, young people and now adults who've been affected by Kawasaki disease. And for the vast majority, perhaps they are not in any kind of long-term clinical care. And we know today that they absolutely should be, where there's been cardiac involvement particularly. So, Society's point of view, we are absolutely determined to raise the profile of Kawasaki disease, not as an acute 6-week event in children under the age of 5, but as a persisting disease which can have whole of life effects. It can affect children as they grow into adulthood, and they need transition of care from paediatric cardiology into adult cardiology and ongoing supervision and surveillance. One thing that people often ask me is where the name came from. Why Society? And it's not terribly complicated or terribly clever, really. I feel really, really strongly that the number one cause of acquired heart disease in children in the UK, Kawasaki disease, should be a matter of concern for our society. If we consider ourselves to be a civil society, then we should have a focus on Kawasaki disease. So for all of society, that's where the name came from.
So can you tell us how Society came about? What are the key main goals for Society? What are some of the current statistics of the treatment time for Kawasaki disease, and how does Society hope to improve them? How does Society Foundation hope to improve the long-term care and treatment given to Kawasaki disease patients?